If you're a nursing student, save this. If you know a nursing student, send this to them. So these nursing questions, 99.9999999 of those questions are based of one of three things: ABCs, ADPI, and this Maslow hierarchy of needs. I've already made a video on the ABCs. I've already made a video on ADPI, but I didn't even realize this, but I never made a video on Maslow's hierarchy of needs. When you get a test question that asks you which patient are you going to see first, basically it's one of those three: ABC, ADPI, or Maslow's. What falls under Maslow's? What is most important to you is going to be that patient's physiological integrity. Anything that keeps that patient alive the longest or can possibly kill them the quickest. That's who you're running to. So what falls under physiological integrity in Maslow's hierarchy of need? ABCs: airway, breathing, circulation. Hemodynamic status. You want to make sure that those organs are being perfused. You don't want that patient to go into shock. You don't want that patient bleeding out. You want to make sure that oxygen, which is carried in the blood, is being delivered to the tissues. What else? Signs and symptoms of a myocardial infarction: chest pain, radiating down the left arm, signs of a stroke. Whenever you see a test question or a situation, I should say, and they tell you the patient's ABC, then all of a sudden they're confused. They're not alert like they used to be. When you see a change in the patient's cognitive status and it's declining, so they were awake, alert, oriented, then all of a sudden their cognition has declined, you're running to that patient. What else? Vital signs, right? Patients' respirations decrease. Don't you think that can kill them? Patients not getting enough oxygen to the brain. Don't you think that can kill them? Low blood pressure, or even high blood pressure, that can kill them. Anything that can physically keep the patient alive the longest or kill them the fastest, that's who you're running to. What else? Fluid and electrolytes. Dehydration, severe dehydration can kill a patient. Their potassium being out of balance, that can cause them to have an MI. So yeah, fluid and electrolytes, glucose. What kills a patient faster, hyperglycemia or hypoglycemia? Hypoglycemia, okay? Glucose, fluid and electrolytes, vital signs, airway, breathing, circulation, hydration. All of those fall under physiological integrity. Those are the patients you are going to be running to first.